Metal species play an essential role in any living system. Among drugs that are used to treat cancer, there are also a collection of molecules that use metal as a base. So today I'm going to be talking about ruthenium anti-cancer drugs. So first, just an overview of the current metal-based anti-cancer drugs. They're platinum-based. The first one that was discovered and the most common used is cisplatin, which is this very simple structure up here. There's also carboplatin and oxaliplatin. So cisplatin, what exactly does it do? Well, it binds to DNA irreversibly, making it unable to replicate. And over here you can actually see when it binds, it causes this DNA to get a bent geometry, which then makes it impossible for it to replicate. However, it does have side effects, including nausea, hair loss, and nerve damage, and it is not effective against all cancers. So let's talk about ruthenium-based anti-cancer drugs. So right now, the three most promising candidates are NAMI-A, which is currently in phase 2 clinical trials, KP1019, which is currently in phase 1 clinical trials. Both of these are considered evolutions of another drug called KP418. And then there's NKP1339, which is a sodium-based analog of KP1019. So here we have KP418, which is the precursor to the current ruthenium-based anti-cancer drugs. And we have NAMI-A right here, and KP1019 here. And as for NKP1339, it's this same structure on the right, but rather than this structure on the left, it's just a sodium ion. So actually, NAMI-A, KP1019, and NKP1339 are the only three ruthenium-based anti-cancer drugs to currently be in clinical trials. And out of all of these, NKP1339 is actually the most promising of all of them because of its high solubility in the blood, which makes it very easy to get large doses. So just an overview of ruthenium in general. It is a transition metal, and it is in the same group as iron. It has multiple oxidation states, ruthenium 2, 3, and 4. But what actually makes the anti-cancer properties of ruthenium? So first off, it's able to enter the cell via multiple modes of transportation. It has passive diffusion, active transport, and endocytosis. There's a little diagram of what endocytosis looks like here. And then it has multiple ways to induce cell death, which makes it very good for killing cancer. It can bind to DNA similar to cisplatin, giving DNA that bent geometry that makes it unable to replicate. It can accumulate in the mitochondria, which is essential to the function of the cell, and it can interfere with telomeres, which is also required in cell replication. In addition to all this, it can block the formation of new blood vessels, which is required to bring nutrients to the tumors, which can keep it from dividing and replicating. But why ruthenium? Well, first off, it has less side effects. In fact, KP1019 was shown to have very minimal side effects with almost nothing going wrong, and NAMI-A was shown to only cause painful blisters on the arms and feet and hands, which is less damage than the nausea, hair loss, and nerve damage that platinum can cause. And in addition, it can also treat some platinum-resistant cancers, as platinum can only treat cancer in the lungs, head, neck, ovaries, and esophagus. But why are there less side effects? Well, there's two sort of big theories about it. The first theory is that it mimics iron, which naturally occurs in the body. Of course, you probably know that your red blood cells carry iron around with them everywhere. And so specifically it binds to transferrin and albumin, which are two biomolecules that are essential in carrying iron throughout the body. It's the second theory has to do with its oxidation states. So as I said before, ruthenium has multiple oxidation states, and ruthenium-3 is inactive and can therefore be taken into the body without causing any damage. And in addition to this, tumors actually cause a reducing environment. So when ruthenium-3 enters the cancer cells, it readily reduces to ruthenium-2, which has the cell-killing properties. And this also works in reverse. So if ruthenium-2 leaves the tumor, then the oxidizing environment turns it back into ruthenium-3. So it only has the cell-killing potential within tumor cells, therefore killing less healthy cells, therefore having less side effects. So in conclusion, ruthenium-based complexes are potent anti-cancer drug candidates with few side effects. Further chemical, biological, and clinical studies on these new drugs are expected to be accomplished for drug discovery. Ruthenium drugs may one day expand our options for treating cancer. Thank you.